In this case study, factors that contributed to Mr. James's frustration and dissatisfaction was that Sarah used a firm tone rather than a calm and soothing tone. This would have caused Mr. James to feel very uneasy. He was also visibly upset, and Sarah didn't use any communication to try and calm him down or make the situation better. Instead of her saying, "We are doing our best, there are other patients who need our attention too," she could have said, "I acknowledge your frustration, so let's talk about this and work through this together." This communication helps demonstrate empathy and understanding of the patient's feelings rather than disregarding them. Other factors is that Sarah wasn't actively listening to Mr. James. While taking his vitals and administering medication, he was trying to convey how he was feeling, and rather than listening and giving him attention, she proceeded without addressing his worries. Sarah also uses very little eye contact with Mr. James. Eye contact is a big part with forming a relationship with the patient and gaining the trust and empathy, which in return means better health outcomes. Another factor is that Sarah is very stressed and overwhelmed with the situation. This would have caused Mr. James to become anxious and it most likely reduced trust as he would have felt uncared for. Another factor is that she left the room abruptly. This would have caused a lot of distress when she didn't address the issues and then left. When she left, she said, "I'll check with the doctor later." Instead of this, she could have said, "I'll check with the doctor for clarification so that you can have a better idea of your condition and treatments, and then I will come back and we can discuss this together." Sarah could have applied therapeutic communication techniques such as asking open-ended questions to Mr. James, such as, "How are you feeling and what are your concerns?" This helps begin conversation and allows Mr. James to freely speak about his concerns. Active listening techniques such as focusing on Mr. James, using eye contact, using verbal and non-verbal cues, positive and forward body language, and being fully present would have improved the communication between Sarah and Mr. James and created a stronger relationship. Especially the non-verbal and verbal cues such as head nodding and using encouraging language to make him keep talking, such as "go on" and "yep," to show that she was listening and understanding what he was saying. Reflection could have been used to make sure the patient knows that Sarah is listening and cares. This can be done by repeating Mr. James's concerns and feelings back to him, possibly even word to word to really emphasise it, as well as exploring these feelings. Other things are expression, gesture, and facial expressions to demonstrate active listening and develop a connection. These techniques are proven to accurately diagnose a patient, build healthier relationships within healthcare, and identify the patient's emotions. Therapeutic communication is very important as it helps the transfer of knowledge from healthcare worker to patient and providing patient-centred care. It is as simple as beginning the nurse and patient interaction, which Sarah could have implemented better, by doing things such as asking questions for Mr. James and also letting him ask questions that he has. This would have had a positive effect not only on Mr. James's recovery, but also his daily attitude toward taking his medication and being compliant with the nurses. This therapeutic communication would have decreased Mr. James's overall anxiety and unhappiness and would have helped him be more cooperative during his treatments, which in return would have had a healthier impact on Sarah and Mr. James' relationship.